Now, we're talking FemTech now. It's new technology that is helping women's health. Lara, Lewington and Dr Hilary are here. When we're talking FemTech, this is specifically for women.
Yes, for years, women's health has been massively underinvested in. Plus, the tech industry has been very male-dominated. So devices for women have taken a while to come, but now there's a lot out there. It's a huge business. And I've got a few of the items here.
Yeah, talk me through. What have you got there? What's that now?
OK, so first of all, let's talk neurostimulation.
OK.
Now, the idea is devices similar to this have been around for a while to treat depression, and they work on brain signals. So they're wearables you put on like this. But this one is called Nettle, and this is aimed at dealing with PMS symptoms and also for menstrual pain. So you wear it for 20 minutes a day, 5 days a month, and it aims to be able to ease those symptoms. Now, the company's research has said that people have had a 67% reduction in pain.
Yeah.
No, it's a 72% reduction in pain and a 67% reduction in mood symptoms.
Really?
So that's our first device.
Right. What do we think, Hills?
Well, look, I mean, the website will say that this reprograms your brain.
Yes.
Now, I doubt, I'm sceptical about whether a simple device like this, worn a bit like that...
Suits you.
Premenstrually, will help regulate your mood, ease your pain. If it did, it would have so many repercussions for all sorts of other causes of pain and mood swings. Has the trial come from their own research, or is it randomised controlled trials that are sort of medical grade?
Maybe if it makes you
research.
think it works, I don't know.
Yeah, there might be a placebo effect.
Sure.
Look, I mean, it's over 400 quid.
Wow.
So I don't know how many women will be interested in doing this, but, you know, try it. I mean, I'm all for women getting what help they can.
No, you're very open-minded, you are, but that seems very expensive.
Especially if you can get your money back if it doesn't work.
Well, this
That's
is what I
what
was
we
saying.
were discussing earlier.
If they're so confident, 60-day money-back guarantee would convince me that there's something in it.
Excellent. What else we got?
Well, there are lots of apps out there for period tracking. Yes. And in fact, Natural Cycles is also pitched as a contraceptive app. So you track your cycle in full detail. Now, you also need to input your temperature. So what you can do is take your temperature as soon as you wake up every morning. You have to wake up in quite a similar window, and you have to record your temperature before you move.
Right.
But what is a simpler version of doing that is to take the temperature from your wearables. It can be connected to the Aura Ring, and that will automatically keep those temperature readings within the app, and so you're not needing to put them in yourself and make sure you're doing them at the right time.
Right, so through the ring that you wear...
That's right. And there are lots of wearables now that can track your temperature. So for cycle tracking, you can now add this into the data, and it helps give you a more predictable date as to when your next period will start.
Oh, OK, and also maybe for when you should have a... You know, if you're trying for a baby, when you should actually do the deed.
Yes, and when you shouldn't.
Yeah. When you shouldn't.
Yeah, absolutely. Although when you shouldn't, it's only a 93% reliability, which isn't great if you want to avoid pregnancy.
No.
OK.
So it's still based, it's still based on what we already know, which is, you know, so the rhythm method.
Sure.
You know, ovulation sort of 2 weeks before your
See,
next
that
period.
when people say the rhythm method, it just makes me think of people dancing while they're at it. Like,
well, that might work as well.
Keep dancing and don't do anything else. That works.
Or dancing wild.
The doctor will agree.
So we're kind of doing that anyway. It's just maybe making it a little bit easier. Again, is it very expensive? They tend to be, or is it sort of affordable?
Wearables do completely vary in price, and with these apps, there are some free versions, there are also subscription models to some of them. So to get those full levels of tracking and to get the full connection of everything, you do end up paying for it. Right. So I think it comes down to how much you want to spend on a wearable, and of course you can get the more basic ones that can do an element of that. But I think better than actually logging how you feel, these devices can really help you quantify stuff.
No,
so I suppose that's the real
thing. It's easier, I guess. And what about going through the menopause?
OK, so we have some bracelets for that.
Right.
Now, for people who are suffering from hot flushes, one of them blows cold air and also cools down the inside of your wrist.
Oh.
So this is the Ember Wave.
Right.
You need to press a button to activate it. It all happens via an app, as you can see here in this video. But if that's feeling like a little bit too much effort and you want it to do it automatically, well, a new device called Grace is coming soon, which actually has temperature sensors in it. So we'll see how hot you're feeling, and when you're feeling warm and may need that burst of coolness, it can automatically provide it without needing to actually press the button.
Actually, it looks quite, you know, it doesn't look like a big bulky thing.
It does. I mean, I
looks like
suppose the funny
jewellery.
thing is you start to recognise it as being that's what it is. So when you see people wearing them, I mean, I don't know, do people mind maybe these things become in vogue. I suppose it just depends whether they do or they don't.
What do you think, Hills?
Well, you know, it's certainly going to cool you down a little bit. I mean, just like a fan or throwing a sheet off the bed. But if you want to spend the money on that, that's all
You
very
do
well.
sometimes see people wearing them around their necks
Oh,
these
yes,
days,
my
those
friend
neck
Helen
bands.
wears them round her neck. She said that, and they said they're absolutely fantastic. What's that wee blue doofer there, and where does it go?
You know where it
Well,
goes.
OK. So a lot of women, after having babies, do have pelvic floor dysfunction. It's a really common problem. And these things are increasingly becoming talked about. And here is a wearable that can help you do some exercises and track your progress.
Right.
So it connects to an app which will give you the exercises and keep logging how often you've done them.
Right.
And, well, it's a way of avoiding actually going to a clinic for it. And, well, I mean, I guess it probably does the job. What do you do with this, Hilary? You're a doctor.
Well,
yes,
you do. Yes, that's all right. You insert that, and it works like a weighted, you know, conical thingamy-bob that they would give you in a continence clinic.
Thingamy-bob's
so you
medical.
insert this, all right. But the difference is, rather than being told whether you're doing the exercises right, the app will tell you, no, you're not quite doing that. You're not squeezing hard enough. Squeeze a bit harder. Do your pelvic floor muscle exercises more efficiently. That's it. You're doing it right now. It's a biofeedback.
That's really clever. So that doesn't... You don't put that in, it doesn't go bing, 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 bing like that, because that'd be different.
No.
But it just tells you whether you're squeezing.
It will sense whether you're squeezing with your pelvic floor muscles adequately and you're doing it right. So
I like that.
It's basically a do-it-yourself way of what would happen at the continence clinic with a physiotherapist.
Exactly. And we forget that sometimes, and we shouldn't, ladies.
No. So there you have it, a device for everything.
That's brilliant. Thank you very much. Thank you.
Pleasure.
Worth a go if you can afford it and you want to have a wee try. Thank you very much.